everyone. My name is Jenna Thomas, and today I'm going to be teaching you about adult CPR. Learning basic life support, or CPR, cardiopulmonary resuscitation, is some of the most crucial skills that you will probably learn. It is something, in my opinion, that all people should know. The advantages to knowing this vital skill are endless. Among these advantages are empowerment, the ability to save lives, assistance, and even employment. So to begin today, we're going to verify that our scene is safe. Seeing that the scene is in fact safe, we're going to put on our personal protective equipment, which is gloves in this case. After putting on gloves, then we're going to check for responsiveness in the victim. We're going to do this by tapping their shoulder and asking them if they are okay. When they do not respond, then we are going to check for breathing and for a pulse. To do these two things, we're going to look at the chest and see if there is any rise and fall for about 10 to 12 seconds. Seeing that there is no rise and fall after 10 to 12 seconds, we're going to check the pulse using our index finger and our middle finger and placing them on the carotid artery. After feeling no pulse, we are then going to move our victim to a firm, flat surface. After doing this, we're going to activate the emergency response system, or call 911, and check for an AED. Seeing that there is no AED around, we're going to continue on with CPR. So to begin CPR, we're going to take the heel of our hand and place it in the middle of the chest and place our other hand over the top. You can either interlock your fingers or leave them just over the top of your other hand. Personally, I like to interlock my fingers. When giving compressions, you need to give them at a rate of at least 100 to 120 beats per minute. This ensures that blood flow is getting to the brain, which is the most important part of CPR. Also, when giving compressions, you need to make sure that they are at least 2 inches deep into the chest to ensure that you are pressing hard enough to make the heart pump. So, while giving compressions, you need to make sure that you count them out loud. This will help you keep track of how many that you've done. During one cycle of CPR, you will give 30 compressions and 2 breaths using a mask. Also, you need to keep your arms straight and your body over top of the victim. This ensures that you will not get tired giving compressions. So, let's begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After giving 30 compressions, we're then going to use a pocket mask. We will take the pocket mask and a filter and place it over top of the victim's face. The pointy part, goes over the nose. Make sure that the nose is completely covered when placing the mask on the face. Then we are going to seal the mask using the C grip. The C grip uses your index finger and your thumb, and you're going to place your hand over the top of the chin. Then you're going to take your other hand and place it on the forehead. Then you're going to perform what we call a head tilt chin lift. So you're going to take your 2 hands and tilt the head back and push the chin up. This ensures that the airway is open while you're giving breaths. Next, we're going to give 2 breaths after we've given 30 compressions. Make sure while you give breaths that the chest rises. After doing this, we will move the head back down and remove the pocket mask and continue another cycle of CPR. After that, we will continue this cycle until the EMS arrives. If someone else is there to help you, you can switch out every 2 to 5 cycles so you don't get tired. When EMS arrives, you need to give them information about your patient, how many cycles of CPR you've done, and what the scene looked like when you arrived. After doing all of this, and when EMS takes your victim, you're going to remove your gloves properly, not letting the outside of the glove touch your skin. You will then place your gloves into a biohazard bag. After doing that, you need to wash your hands or put on some type of hand sanitizer. And that is how you properly perform CPR. The importance of knowing and being able to perform CPR is huge. Certification in CPR allows people to step up in emergency situations, whether they are medical professionals or not. So make the decision to become CPR certified so you can save someone's life. Thank you.